And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap between fitness professionals and medical professionals. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 59, I'm joined by Sami Mansfield. Sami is a cancer exercise specialist, and she's actually started a consulting organization devoted towards cancer and exercise. And as she'll talk about in the episode, there are over 17 million cancer survivors in America today. So this is a vast population that needs treatment and care to make it through their cancer treatment, but also to live a fulfilling life afterwards. And we're going to dive into some myths and some misconceptions, but more importantly, some actionable things to know about how you become a cancer exercise specialist. And I think this greatly aligns with the wellness paradox thesis of how we bridge the gap between fitness and medicine, because as Sami talks about, oncologists don't want to and don't know how to do exercise prescription. And this is where there's a great opportunity to become part of that healthcare team by being a cancer exercise specialist. I think you're really going to enjoy Sami's perspective and her learnings from her time in the industry. I know I did. Any information we'd like to share with you from today's episode can be found on our website by going to wellnessparadoxpod.com/episode 59. Please enjoy this conversation with Sami Mansfield. Today, we're delighted to be joined by Sami Mansfield. Sami, thank you so much for joining us.
Thanks for having me. Excited to be here.
So we're going to get into a conversation that I feel like has been growing in our field for some time with probably some myth and misconception packed around it. And that's cancer and exercise. And Sami, that's what you specialize in. And we're going to dive into that topic. But before we even get there, why don't you just tell us a little bit more about your background to provide some context for our discussion?
Absolutely. I'm fortunate and maybe unfortunate, but I fell into this profession completely by accident before it was kind of a thing. So back in 2003, I was working at a large fitness center and I got this referral for a new client from our membership department. And I'm sure a lot of your audience can relate to this. And I remember calling her up on the phone and introducing myself and talking to her about our training sessions. And she told me she had was diagnosed with breast cancer 2 years prior, and she's doing good, except she goes through this laundry list of all of the side effects she's having: lymphedema, depression, anxiety, weight gain, reconstruction issues with her implants, and all of these terms that I'm like, I have no idea what they are. And I remember writing down this, list of things to Google. And her last question to me was, do you think you could help me? And of course, anybody that believes in exercise the way we do, we're like, yes. Yeah. And I remember getting off the phone and after setting up that appointment and thinking, okay, now I've got to research this. And there really wasn't anything. Mm-hmm. We didn't even tell patients in 2003 to exercise during treatment or after. We're just like, you're good. Yeah. And so I just felt it was my home. I felt that it was one of those places that I belonged. And it really took a step back and realized it was just a very needed population. Almost 20 years ago, there was 15 or probably 12 million cancer survivors. There's now 17 to 18 million, people living after a cancer diagnosis. So at that time, there was no research. So that has definitely evolved. And it's been exciting to be in the front and to help professionals come back now with the research and do more, because our patients are still needing this really important and valuable piece of their care.
Yeah, I think that's a story that a lot of our audience can relate to, of having somebody in front of them with insert medical issue here and saying, wow, I understand the condition broadly, but I actually don't know if I can help you because I haven't been adequately trained. So I think that's not unique with cancer, but I think cancer, because it is so just systemic in nature, even if not the cancer is not systemic, the way the body's affected through the treatments, it is a very unique area. And so you developed an organization, around this, Cancer Wellness for Life. Tell us a little bit more about that.
Correct. So I started, like I said, my early career in the fitness space. And then after about 7 years of being out on my own, working with individuals, I started into the medical space myself. So back in 2010, I was recruited to start an exercise and wellness program for a community-based cancer center. And I really enjoyed that role because we put exercise into the hands of our physicians, oncologists, our nurses, and really throughout the various capacity of our staff. But I remember in that situation, and I ran a cancer exercise clinic. I had this day, I walked into work on a busy Monday, looked at my schedule. I had 14 patients to see. And the scheduler turned to me and she said, "You have a really busy day." She said, "But it's really busy at the cancer center." And I said, "Oh, really?" And she said, "Yeah, our census today was like 420 or something like that." And I remember thinking specifically, what about everybody else?
Yeah.
And so I realized, and there was this opportunity of not just working one-on-one, but taking a step back, looking at the healthcare space and figuring out how to drop in exercise and other wellness strategies within all of this, the cancer care community, academic, whatever that may be. And so we started a consulting organization where we work with hospitals and cancer centers, pharmaceutical companies, different organizations that get it, and they're looking for ways to integrate into that cancer care plan. And I'm very passionate. We need a stronger workforce. We need a workforce that can plug in these next pieces because patients love to talk to a trained professional that can answer their questions. And so that's really what we do, both on the healthcare side. And then when I have those opportunities for the fitness professionals that are really looking to get into this career, because it is life-changing. It has changed my life. Yeah. And so I know it's going to be something that has a lot of opportunity, and it's going to take somebody like me that, knows how to work on the healthcare side to help with that.
Yeah, you said it. And, opportunity is there. And I look at the fitness landscape, and the fitness landscape is highly competitive and only serves a very small portion of the population, 15 to 20% at best, commercial fitness clubs.
Right.
When you start to talk about the medical population, actually turning fitness professionals into more healthcare providers, that's a great statement in theory, but you hit the nail right on the head. If we're going to do that, we need workforce development, and we need
absolutely
those providers. Yep. And so that's why I'm excited to have this conversation with you, because I'm hoping that there are some people that are listening out there that will say, wow, this is not only a fulfilling opportunity as a fitness professional, but this is also a great business opportunity. I think you said there's 17 million living
easy
cancer survivors. Yeah,
absolutely. I mean, and I think the thing to really think about is, I think about as a fitness professional and really even understanding a lot of the other aspects of wellness and kind of geeking out on nutrition and psychosocial. I can study all of these things. And I know oncology because I've been working in the field for almost 20 years, but every day a new drug shows up that I learn. Yeah. And so I always tell people, we are not oncologists, but you can go to an oncologist and ask them about the drugs and ask them about side effects, the same way that oncologists are expecting people like myself to tell them how their patients should exercise. And all they want to do is give a green light. They don't want to actually give exercise recommendations, even though, and I find this frustrating, all the websites are like, talk to your doctor about an exercise program. And my doctors are like, I don't have the training. That's like me being like, oh, you should take this drug for that. Exactly. And I think that, large studies that really ask oncologists, 98% of oncologists in a really large national study believe in the power of exercise for their patients, both for function and things like weight management, side effect management. Same study, 95% stated, not my job.
Yeah.
Not meaning to push it off, but saying, I don't know.
Right.
And so to me, that's this opportunity for the fitness professional to say, oh, my job, and be able to bring that to the table. And really our oncologists and our health systems are starting to realize and look for these professionals. So again, that's kind of why we went the consulting route and why I'm excited, but we need more workforce. And I know that's the next phase of this, so that we can bring the workforce into the healthcare environment, exactly what your mission is and why I'm excited to be on this podcast.
Yeah. And I feel like we can keep having that conversation, but
Yeah.
I want to make sure we're on the topic at hand. And so with regard to, cancer and exercise, I mean, cancer it's such a scary word. And I think it conjures up so many different images of people of, debilitating end stage, cancer. But the objective reality is that you certainly can be exercising. It helps the process. There's volumes of research that now state that. Yet there still are a lot of myths and misconceptions around cancer and exercise. So I'd like to start there before we get into the current evidence. And just what are the things that you hear from either cancer patients themselves or people in the medical community that kind of permeate the consciousness, but don't actually have a lot of substance behind it?
Absolutely. And definitely so true. I think there are probably a couple of things. I think the number one question is, should I exercise if I'm on treatment? Meaning, I'm getting chemotherapy, I might be getting radiation. We have new, more progressive treatments like immunotherapy that have less side effects. And patients are like, should I be exercising if I'm on X, Y, and Z? And the answer is overwhelmingly yes. And I think that, again, patients are, especially in cancer, if their doctor doesn't tell them, they're uncertain.
Sure.
And so it's just kind of, taking that off the top of, making sure that people know they should, even if your doctor doesn't tell you. I'm like, well, does your doctor tell you should eat 5 meals a day?
Yeah.
Does your doctor tell you should go to sleep at night and go to sleep at a regular time? People are like, no, but there's this perception of physical exertion. And does that hinder my recovery? And like I know we're going to talk a little bit about the evidence coming forward, but I think that that's the most important thing. The other misconception is that cancer survivors, again, could be in treatment, could be out, should just do things like gentle yoga and walking. There's no evidence saying that gentle exercise is right for all cancer survivors. And in fact, most of our cancer survivors don't do enough to create a stimulus, to create benefit, and we almost need to push them to be stronger, right? There's a study that says 75% of people impacted by cancer reduce their exercise and physical activity in the first year. 75%. And so thinking of our numbers, that's a pretty big impact just off people exercising or not exercising. And a couple of specific things, lymphedema is a big one. When I started my career, we were like, don't ever lift more than 5 pounds, ever. Well, that wasn't evidence-based, but we didn't really understand lymphedema. So that was just sort of this, let's just tell you to do nothing. And we realized that that was exacerbating lymphedema. People aren't sure if they should exercise with a port. There's no evidence to say that you can't. You shouldn't do contact sports. So I tell people, please don't start with rugby. Yeah, right. But go for a run. You can lift weights. You can do push-ups. You're not going to hurt, exercising with a port or some of the other side effects. There's literally not a side effect that I'm extremely concerned about as an exercise professional that a patient should avoid exercise unless they have a surgical restriction. That's it. Other than that, every patient has a green light, every single one.
Yeah. And I think that's so important. And I think this kind of in general comports with the broader view of health conditions. I even think of pregnancy as an example years and years ago, where they just said, hey, just rest, you're eating for 2, 50-pound weight gain wasn't uncommon. Now we're saying, hey, get out and move. And we've always kind of taken this approach. And I'm actually okay with this approach of, first do no harm. Like, let's make sure we don't make anything worse, but we need to shift that paradigm around, not only should you be moving, but actually you should be moving intensely enough. And I feel like across all populations, there's not, it's not, the issue is not too much exercise or too much exercise intensity. It's not enough exercise and not enough exercise intensity.
Absolutely. And I think that people, once they hear it, it makes sense to them, and there's just this sort of fear and truthfully, people with cancer, they really do ask specifically, like, what should I eat?
Yeah.
But then in general, if you tell them what to eat, talking about the latest and greatest, they're like, ooh, are you sure I can't just have milkshakes?
Yeah.
You know? And
Yeah.
so then there's this pity party of like, well, you have cancer, let's just go ahead and have as many milkshakes as you want. And we really do forget that we're harming our patients.
Yeah.
We are reducing their chances of survival and we're adding to their side effects. So there needs to be some more reiteration to the value of these types of things. And so that's, of course, where the evidence has gone, but also educating our staff that takes care of patients. I mean, sometimes my 20-year experienced nurses can be my worst,
Sure.
like here, have the bag of chips. Like,
Yeah.
no,
Yeah.
but we're getting there. And of course, the evidence is getting there. But I do think there is a lot of opportunity to train our workforce. I do think it's hard if you're coming into the exercise profession to get the information. And also, you don't have to know everything about cancer.
Yeah.
There's this attitude, patients, cancer survivors in the medical and the fitness setting, they want you to understand, but you don't need to know everything. And I tell people it's a great way to build rapport with your client or your patient. Have the basics and then let them share with you what they're experiencing. And then you're tailor making their program as you go. And that's what a patient really wants. They want a personalized program, just like their medicine. They want to know it's fit to them, not everybody. And I think that's really powerful for us.
Yeah. And that's important. No one's asking a fitness professional to become an oncologist here, but you need to know enough to develop that rapport. And to that end, I mean, you've alluded to the research, and this is I'm a nerd like you. So this is a part of the conversation I know we're both excited to get into. Talk about some of the emerging research that would really be actionable for our audience to understand.
Absolutely. The emerging research is really exciting. I want to kind of bring forward just to start this conversation that the guidelines for exercise for cancer survivors are now up to par with the US physical activity guidelines. And one of the things that I think has changed only recently is to add resistance training into the recommendations. That was not published until the end of 2018.
Wow.
So that's pretty new.
Yeah.
The first guidelines were 2008, were just the 150 minutes of moderate, et cetera. But the strength training guidelines were not updated until very recently. And I think that's important to note. And one of the reasons why is we know sometimes studying these can be difficult. So, anything about the mouse studies, right?
Yeah.
Exercise and resistance training can be kind of intriguing, but the preclinical studies that are happening in cancer are exciting and fascinating, looking at how exercise can actually improve treatment efficacy. And so I'm not sure, if anybody here knows, but I want to educate you on the severity of a diagnosis of pancreatic cancer as an example, because this is where one of the studies that's really exciting is going. So if you're diagnosed with pancreatic cancer, your 5-year survival is 9%. A lot of reasons why, but 9%. So pretty bleak. So we've done some research in exercise in pancreatic cancer. And one of the newer mouse studies looked at, rather than just exercise alone and chemotherapy alone, it actually put these together. And what we're seeing is that exercise creates a really important change in what we know as tumor vascularity. So for all of us that are kind of lay professionals, that means that the tumor is going to have increased blood flow when you're getting chemotherapy, which is a systemic treatment. Your tumor is now uptaking as much chemotherapy as possible, allowing that chemotherapy to do its job. So as an example, our preclinical or mouse studies are looking at survival using a combination, and I think this is key, of chemotherapy or treatment and exercise. And we're seeing this in other types of cancer. Colon cancers is another one. Esophageal is another one. I think we'll start to see this in like breast and prostate. But if it works in pancreatic, that is a benchmark for us as in the oncology field. There's a lot of similarities in cancer genetics that would apply to a lot of other populations. So that's amazing when you're looking at it really improving survival. I think that another really key study that just came out is looking at exercise in the advanced cancer population, specifically bone metastasis. So for anybody new to cancer, that means that the cancer has progressed into the bone, which is one of the primary locations for a lot of our primary or solid tumors like breast, colon, prostate. The first place it moves if it advances is into the bone. Well, again, as an exercise professional, it's like, what do I do?
Yeah.
In the oncology setting, we might tell someone, oh, take it easy, don't fall. And for a patient, they're like, do I get on a walker? Do I sit around? And so we've really worked hard to say, okay, what does the evidence say? Well, we just published a new guideline that says patients with bone metastasis have more benefit from exercising, including resistance training, than harm. So that's fascinating stuff. But now it's like, okay, let's translate that so that if I'm a fitness professional in a gym or a cancer center, I know what to do. So seeing a lot of change in the last 3 to 5 years, definitely. And I think that that's going to be the next phase of what we do. But I love that stuff. I'm like, that broadens our reach.
Yeah.
And that improves people's quality and survival. And I've not seen another complementary modality that does that, that exists, no
Yes.
matter what I've looked at.
So fascinating. Yeah. I like, there's a part of me that loves to get into mechanisms that we won't in this discussion, but just
Sure.
on a very surface level with the resistance training element for people with bone metastasis, it makes sense. Resistance training is the best way to improve bone mineral density. And it sounds like, fortunately, having your resistance training while having bone cancer does not change that mechanistically enough for the patient to not derive a benefit, which is, I mean, that's amazing.
Absolutely. I mean, we now are recommending that a patient with new or progressive bone mets see an exercise professional that's trained in cancer. Some of the caveats in these more complicated patients certainly is supervised exercise versus home-based exercise. So to me, that is then that trigger of, okay, we need more qualified exercise professionals. But seeing that change from, this clinical workup, when those opportunities for patients going, oh my gosh, I have cancer, it's really kind of bad. What do I do? Seeing that evidence is really exciting. And then just seeing the standardization of studies looking at all of the side effects of our cancer patients, from financial toxicity to sleep to depression, to social isolation, as this really great tool, is really, really exciting. And just to see it published. And I'm not going to do a lot of research. Like, we definitely support research, but I like to let the researchers do research. I like to do implementation. So yeah, it's fun to see, really fun to see.
Absolutely. We're gonna get into some actionable things here in a second. So,
Sure.
I mean, we're kind of going from high level to more how to operationalize this. But the one thing that just came to my mind is we're thinking about this on the patient level, and I'd like you to speak to this. Now, I've never had cancer, fortunately, and I've really never known anyone close to me who's had it. But I feel as if just the loss of autonomy associated with something like cancer has to be very psychologically debilitating. And I'm curious for you to speak to almost the reattainment of a degree of autonomy when you are exercising. Like, it feels like they have at least some ownership over their health during a period of time where they might not feel that.
Absolutely. No, that's a great question. For patients, the number one side effect that's reported is fatigue, but it's a very general side effect. So it could be loss of muscle. It could be I'm sitting in, 5 days a week of radiation, or, I'm doing chemo and radiation at the same time, or whatever that may be. And so, if we just tell patients you're going to have fatigue, but we don't give them an actionable to improve fatigue, they're going to be like, I'm just sitting in the chair. And so one of the things that's very important in survivorship is to give people empowering tools so that they proactively know how to recover from, reduce side effects, etc. So I 100% agree. Giving someone an exercise program that they can feel that they're doing something does make a huge difference in not only their fatigue level, but their side effect. They're just side effect trajectory. So the cancer centers will say, the patients that exercise, they call in less to the triage line. They come in to see the doctor, and the doctor's like, how are you doing? And they're like, fine. Okay. Like, and patients will say to me, I'm not really that tired. Do you think my chemotherapy is working? I mean, that's because they're worried. And so, we have to have this conversation of saying no, but, it's because you are above the average. You're controlling how your side effects are going to affect you. You might have some, but not as many as other ones. So I do think we need to empower patients with this actionable. And honestly, I've been throughout my career tremendously surprised of the patients that somebody was like, they're not, or the patients that a nurse might say, you can talk to them, but they're not going to be interested. And it's often because we judge them.
Yeah.
Maybe it was a 50-year smoker or somebody who comes in from, rural central United States, who comes off their, meat and potatoes and their cream corn vegetable, and they've never really talked, they've not exercised, they've not done anything. But when you have the conversation, to your point, this is something you can do and you can personalize it. Patients, more than often, they'll at least try. It's rare that someone tells you, nah, I'm not interested. More and more patients are like, oh, I can do that at home. I'll do that. And so I think that's really, really powerful when we're working with patients.
I'd like to take a quick break from today's episode to tell you more about one of our sponsors. As all of you are well aware, the COVID-19 pandemic has been absolutely devastating for the fitness industry, with upwards of 1/3 of our clubs closing nationally on a permanent basis. One of the few stabilizing forces during this very tumultuous period of time has been IHRSA, the Global Trade Association for the health and fitness industry. On my crusade to make fitness professionals part of our healthcare continuum, the work that IHRSA is doing is absolutely vital. They provide advocacy and lobbying support at both the federal and the state level. They support state alliances in many ways, and they also provide resources and best practices to club owners, operators, and individual fitness professionals. Indeed, if we are truly going to become part of the healthcare continuum, we must speak with one unified voice. We must have best practices that we implement, and we must come together as an industry to ensure the public, the medical community, and lawmakers hear our message loud and clear, that movement is medicine and it is essential. That is the work that IHRSA is doing. They've recently revamped their membership structure, allowing large clubs, small clubs, boutiques, and individual professionals to join the organization for an appropriate price that allows them to have access to all of these many great resources and allows us to unify and amplify our voice as an industry. For more information on the amazing work that IHRSA is doing, go to their website, IHRSA.org. That's IHRSA.org, IHRSA.org, to look in a little bit further into the work IHRSA is doing to unify our industry, to move us closer to being a part of that healthcare continuum. Now back to today's episode. Yeah, awesome. Well, I want to get actionable for the fitness professionals that are listening. And I mean, there's a lot of things, that we can talk about here, but if I'm someone who's listening to this and I'm going, well, this is intriguing. It seems like a fulfilling job opportunity. It also seems like a potentially good business opportunity because there's demand, but there's not enough workforce to meet the demand. What are important things for them to know?
Great question. I think number one, if you want to work in oncology specifically, you do need to get some form of oncology training or understanding. So you have a little bit of the basics of at least knowing treatment words or words that your client or patient would say. You don't have to know everything about cancer. I think there's this mindset of, again, I have to know everything about every treatment. Not necessary, but you need to understand the basics so you feel confident. I also really recommend, and this is to me was a very successful strategy when I was building up myself, identifying yourself to have this brand as being a cancer exercise specialist. And you don't have to just do cancer, but you still have to own the fact that you're more than chronic illness, because cancer survivors, cancer patients, however you want to term them, they do look for specifically trained professionals. And I think that that's really something that they're trying to connect with, specifically, like to your point earlier about pregnancy, or I think, maybe even cardiovascular, same thing. I do really believe that you're going to want to work to create a little bit of a brand that identifies you as a cancer specialist, because your oncologist also will be looking for that. They want to know that kind of this scoop. I don't think you necessarily have to go, spend your entire career doing that or your entire time doing that, but I think having some training would be good. Getting connected with medical professionals, I think we have this attitude of like, go to the office, ask for a meeting. Nobody does that.
Yes.
I really recommend build your brand, build a simple website, build a little bit of experience, and try to target maybe one or two healthcare professionals to drive those referrals to you and create this wheel of communication. As an example, often our breast cancer patients are definitely looking for more exercise, more of these types of strategies. And that might be a good feeder source. From me to you, breast cancer is actually one of the most complicated patients to take care of because they have multiple surgeries. They're on hormone blocking drugs for 10 years. They have weight gain, they have chemo brain, they have a lot. They're a fantastic group of patients. But sometimes our underserved patient populations, like your GI or your pancreatic or blood cancer, learn a little bit more about those. Those could be great targets that are underserved populations versus everybody, we call it pretty in pink. So that's something to think about. But I do think it's trying to connect with, a physician specifically, or even nursing staff. Rehabilitation staff is great, but you've got to establish your brand before you bring it to them. Otherwise, you're just like everybody else. So spending that time in this specific population, I think would be very, very helpful to start. You've got to have something to show.
Yeah, and I think that that's such a great point. And you could have the most valuable, cancer exercise plan in the world, but if no one knows you're doing it and you're not getting referrals, you're not going to be able to help anyone. I'm curious on two follow-up questions. First follow-up question is, in terms of educational resources. Certainly you have some that you probably could provide yourself, but also broadly speaking, I know ACSM is a cancer exercise specialist. So where do you recommend that professionals go? What's kind of the breadth of what's out there?
Yeah, there's really only three main cancer exercise credentialing opportunities or certifications now. So ACSM has their cancer exercise trainer. ACE, the American Council on Exercise, is partnered with an organization called CETI, which is the Cancer Exercise Specialist Institute, I believe. But I think it's quite general. So for a healthcare targeted exercise professional, I would probably not suggest that one because I do think ACSM is definitely the most important or the most qualified, as far as gold standard. The other new and emerging one, which is actually starting to partner with ACSM, is called CAN Rehab, CANREHAB, just as it sounds, and we can add that to the links for later, which is out of the UK and is very much driven towards the exercise professional and is another really good certification. But those really are it. There are resources that are available, but from getting actually a certification, those would be what I would recommend as well. I don't provide a certification. I definitely provide education. And I tell everybody workforce development is very important to me. And I remember in my early career, no one responded to my emails or my messages. We didn't really have the social media interaction we do now, but I promise if I get an email from somebody, I will respond. And I may not have the best advice, but I do believe that there are, it's great to be able to ask somebody just a tip or a tidbit. So I always tell people, you could reach out to me and I'm happy to send you an email back. And if I can be of support, absolutely, for sure, I will.
Awesome. And we're going to link up to those three certifications just so people have a chance to check those out on the show notes page. I do know from being involved with ACSM a decent amount that, that is a big area of emphasis for them. I want to say their past president had a very,
Yes.
very, very strong interest in exercise oncology. And so that definitely helped. And I can attest to if you email Sami, she will email you back because that's how this happened.
Yes.
So let's talk a little bit more about this branding and this marketing piece. And you said you one or two physicians, and I can't help but think one or two physicians is a lot of patients. Like, I feel like even if you had one physician, that's probably more, if you do it the right way, that's more business than you can necessarily handle. Right. I guess I want to frame this question the right way. I'm curious as to, for you to help us look under the hood of what that relationship with a physician would look like? Because I've developed these during my career as a trainer, not with oncologists, but with other physicians. And I've seen it work really, really well. And I've seen it kind of not work so well and fizzle. So, talk about, at least from the fitness professionals and, what they can be doing to nurture and cultivate that relationship properly.
Yeah, no, great question. I think one of the things we really need to recognize as fitness professionals is most physicians believe this is important. They don't have the time, but they love a good resource. Because if you have a resource that they can hand off to the patient, you're making their life easier and they like you even more. Results, bonus, cherry on top. So one of the things I recommend is, remember the branding idea that we talked about earlier? Put together something that could be given to the physician, their nurse, whoever, that the nurse can provide directly to the patient. That's more than a marketing piece. It has to be somewhat actionable. Here's a simple example. If you know an oncologist is taking care of maybe patients that have a more advanced, thinking about maybe a pancreatic cancer, that might be a more debilitated patient, you could put together a piece that has, here's 4 home-based exercises that you can do. Here's some base recommendations. You need more information. Your information is already there, but the patient and the physician are seeing an actionable. And so you've created a marketing piece that then will be utilized for the patient, because it's not just a marketing piece. So I really believe the way with physicians is to give them something that they can implement on the spot. All they have to do is, oh, you want to exercise? Do this. That's it. And then that piece then empowers the patient to also take action. So when you get the patient, they're probably going to be more interested. Okay. And to me, if you want to work in the healthcare space, that is literally how I put my foot in the door of the healthcare space. So I started with educational collateral, and then I said, hey, maybe we should do a class.
Yeah.
Maybe we should provide something. So then the physicians started promoting, say, a program. And then over time, they were like, ooh, we really need to talk to patients when they're sitting here. So then I started going into the cancer center. So look at these as these progressions, but that marketing piece should be something that fits your brand. And so if you want that type of patient population, that's the marketing piece that you should come up with. If you want a fitter population, a more functional population, target your marketing piece there, because you will get kind of what you give in this space. But plug and play, make it easy. Make it super, super easy.
I love it. And I want to abstract an important principle from what you said, because it's like one of the fundamental beliefs I have about life in general. What you talked about with that, creating that piece, yes, it's a marketing piece, but really it's a value add for the physician and the patient. You're not making it transactional by saying, here, give them this flyer that says sign up for my program. You're saying, hey, here's some good information. You build value, and then progressively over time, that led to an opportunity to monetize that. But you didn't lead with that. You led with building value.
100%. And we have to put this value in where anyone can see it. I think you'd be surprised the number of nursing staff that's like, oh, intriguing. In the cancer center space, I get tons of nurses and even physicians that are like, oh, hey, so can I ask you a question? My knee's been really bothering me,
right.
Or I've been gaining weight, and I know you eat healthy, or and so it's just another opportunity for rapport, is, being there also for your physicians and your nursing staff, because healthcare right now is having its own mental health crisis. It is really bad. And so I think that there's another way that you can be a value add for your physicians and for your clinical staff. And so there's, I think, a lot of creative ways around that. But yes, it is all about value add. Nobody wants marketing materials. They want to know, what is it and can I do it now? I think that is a really, really beneficial tool and opportunity. And put that information up on your website, share it on your social media, use professional platforms like LinkedIn. Be on those professional platforms where you have that brand identity, and use the same stuff over and over, and people will recognize it to be your brand.
Yeah. And I think it's important to be clear on something for our listeners here as we go throughout this conversation. We focus solidly on misconceptions, some of the emerging evidence, but one of the big things that you're saying here, and I think this is an important takeaway, is that if this is going to be successful, you need to get the word out there that, one, this is safe, two, it's effective, and 3, that you do it. And without an actual conscious effort on behalf of the fitness professional to do that, it's not going to be a reality. So I think that the business lesson you're teaching here is very interesting.
Well, and no, I appreciate that, because I think that it is a business.
Yeah.
Right. We're in the business of course, helping patients, but we all need to take care of, we need to build a business.
Yeah.
Right. And I think that one of the most powerful tools right now that we have in our back pocket we don't utilize is, nobody wants to read those sort of like, you should exercise. It's recommended to exercise 150 minutes per week. People want to know, why is this beneficial for me?
Yeah.
Those facts and statistics are out there. So if you target a specific population, find a research study that backs that and share that from, in every ounce of your marketing collateral, or share that with your physicians. Or another great marketing tool, bring your physicians a study. Not just throw a research paper on their desk, but they definitely like a research paper. But, a lot of times if I'm doing physician driven education, I'm like, here's the research, here's a bullet.
Yeah.
Because most of us have an attention span of, 0.6 seconds.
Right.
A physician may give you 3. And I think that that's something that when I take like the preclinical model that I was mentioning earlier about pancreatic to my physicians that treat pancreatic, they're like, seriously? This is incredible.
Yeah.
Like, so every patient, and, again, it's that opportunity to have a conversation. Then they also deem my value as being knowledgeable in the research, not just the delivery.
Yeah.
And so those are really key pieces for anybody. You don't have to be a scientist or a geek like us. It's out there.
Yeah.
It is definitely out there to translate, and make sure that you're using what's out there to back what you do.
Awesome. Super valuable lessons. Where can people go if they want to find out more about you and all the amazing work that you're doing?
Definitely. So our main website, which we'll link, is just thecancerwellnessforlife.com. That's the best way to find me. Other than, I would suggest LinkedIn is another great way to find me. Personally, I go into lots of social media, no social media. I do a little Twitter, but it's not something that I do a lot of. But if you email me, my email is just Sami, SAMI at thecancerwellnessforlife.com. Like I said, and Mike reiterated, I will email you back or message me through LinkedIn. Those are the best ways to find me and my work. It's interesting, our work in a company is a little bit under the hood, in meaning we do a lot of work with organizations that we are not the brander. Yes. So as an example, there are things that we've done, pharmaceuticals are a great example, where you may not see Cancer Wellness for Life, but it's a lot of what we do, and it's the kind of work that we do. So I would encourage your listeners, if they're interested in sort of some ideas or samples of that, you may not see it on a hospital website, and you may not see it on an organizational website, but if there's a specific thing, reach out to me and I'm happy to provide you, at least if there's information or a tool out there that we've developed, more about that as well.
Awesome. And I will link up to your LinkedIn, which is, I believe, how we connected originally, your email, your company's website, and then all the other things we've talked about during the episode on the show notes page, so everyone has access.
Yep.
Before I let you go, and again, I'm going to say on the air that I think we're going to have to bring you back to get more on the mechanisms and things like that, but we'll save that for now. My last question is the question I always end the podcast on, and because it's the primary thesis behind why I started this podcast, and I'm keen to get your insight, because to some degree, to a great degree, you've actually solved the wellness paradox on a very small scale yourself, which is, the wellness paradox, as I view it, is this gap in trust, interaction, and communication between fitness professionals and medical professionals. Mm-hmm. I'm on a mission to close off that gap. If you could give fitness professionals one piece of advice to close it off, what would it be?
Just one. Yes. I would say this. We don't want people to be drinking from the fire hose. So find one piece that you really truly are passionate, knowledgeable, and excited about, and really target that message home, and just, use the evidence and the facts and put that everywhere, because people are looking and listening. And I think that we have to be more confident that we do have a place at the table. Yeah. And if you get invited to that table, you get invited for an opportunity to share, there's a reason. And so having the confidence to give something specific is, to me, one of the most important tools that you can do. If you are at the table, then be prepared, be able to share something that's fact-based, add that value. Just give somebody one thing. And I know here I could talk a lot, like I said, but nobody wants to drink from that fire hose. So focus on what's your one thing. What's one thing you want everybody to know, and use that.
Awesome. What's your one thing? Sami Mansfield, thank you so much for joining us on the Wellness Paradox.
Thanks, Michael, for having me. Look forward to hearing from you guys.
Well, I hope you enjoyed that conversation with Sami as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares make a massive difference for us. Any information we'd like to share with you can be found on the show notes page by going to wellnessparadoxpod.com/episode 59. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again next week, please be well.